Good evening, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, it reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups, around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know about management of melasma from an expert. So let's connect today with our skin expert, Dr. Kunal Sinha, live from Patna to make us aware on management of melasma. Dr. Kunal Sinha is consultant dermatologist at Mahavir Vatsalya Hospital, Patna. He's a member of Cosmetic Dermatological Society of India and medical head of Redefine Skin Clinic, Patna. Today, Dr. Kunal will share with us on management of melasma. A very warm welcome to you, Dr. Kunal Sinha. Hope you're doing good, sir.
Yes, thank you. Thank you very much for kind introduction. And yeah, I'm very good. So here today we are here to talk something about melasma, something general so that the people can get the benefit, general mass can get the benefit of this session.
Exactly, right. Because it's such a common problem. But the thing is that we are not either aware of it or even if we know something about it, we often say that a little or less knowledge can actually be really dangerous. So that do happens with us. So today we are going to, understand the whole theory about melasma, how to treat it, what are the causes, etc. So to start with, doctor, first of all, we would like to know what is melasma. Melasma hai kya?
Right, as you rightly said, Indian skin is prone to melasma. So what is melasma? Melasma is one of a kind of hyperpigmentary disorder. So it usually presents in the form of bilateral dark brown to macules to patches. It can be present over your malar area, nose, forehead, and even other parts of your body, like even in some cases, hands are also affected in rare cases, right? So it's a kind of hyperpigmentary disorder. So hyperpigmentation is an umbrella term under which a lot of diseases come. Melasma is just one of them. And it's not just a hyperpigmentary disorder. It comes with, it's also a hormonal issue that we have to deal with. So, and yeah, these are the major, by definition, if you will go, this is the definition of it.
Okay. And now we would also like to know what are the causes responsible for it, for melasma?
Right. Very important question. So what are the causes? So the first and foremost cause is the UV exposure. The exposure to the sunlight, UVA as well as UVB. Other than that, the various other causes, just to complete the list, it could be due to smoking. In pregnancy also, it's very common where we call it cloasma. A different term is used when it comes during pregnancy, right? And it could be due to oral contraceptive pills. It could be due to various other phototoxic drugs. And yeah, these are the major causes, the common causes of melasma.
And as you have, previously stated that hyperpigmentation is an umbrella term, and in that melasma also, exists. Melasma is also there. That means that they are different. Melasma can be hyperpigmentation, but all hyperpigmentations can be melasma.
Exactly. That's how it goes. Melasma is a type of hyperpigmentation, but not every hyperpigmentation is melasma. right? We
Okay.
have other things also, FD. I mean, the list is innumerable, right?
Right.
There are
And
n number of hyperpigmented causes, right?
okay. And thus, doctor, we would like to understand that what are the signs and symptoms of melasma and how it is different from hyperpigmentation. मतलब एक बहुत आम लोगों के पर्सपेक्टिव से अगर मैं पूछूं तो उनको लगता है कि देखो पिगमेंटेशन हो रहा है, मलाजमा तक तो इतना अवेयरनेस नहीं है कि लोग ये समझ सके कि ये जो पैचेस है ये मलाजमा है, लेकिन हाइपरपिगमेंटेशन या पिगमेंटेशन हो रहा है स्किन पे इतना काफी लोग बोलते हैं। तो ऐसे में कौन से वो सिम्टम्स एंड साइंस है जिससे हम समझ सकते हैं कि ये हाइपरपिगमेंटेशन है या ये मलाजमा है, उसके बारे में आपसे जानना चाहेंगे।
See, as such, signs and symptoms are concerned. मतलब signs and symptoms इसमें there's it's asymptomatic. इसमें कोई itching, कोई pain, कोई ऐसा I mean symptoms नहीं होता है. It's a clinical diagnosis. I mean, once you the part of the area affected, usually the malar area is affected, and the patches are dark brown to grayish in color. So, and other type of hyperpigmentations are also there on the face, like acne pigmentation. Like once you get acne and you burst it, you get we call it PIH, post-inflammatory hyperpigmentation. So the hyperpigmentation, all of them looks same, almost same, like it will be a dark colored area on your normal colored skin. So,
Okay.
so melasma particularly, so the malar area is affected, the forehead, the nose, and the clinical picture is quite distinctive of other causes. So you can easily diagnose and easily come to a conclusion that you are suffering from melasma.
Okay, fair enough. And doctor, what are the risk factors for melasma?
Yeah, risk factors are like exposure to the UV or UV constant exposure to the sunlight. Like in India, then most of the there are many it's a farming country, so most of the farmers, they work in the field for long duration of time. And other people also, like the people who are in marketing and other field works, so they constantly get exposed to these UV and UVB light. So this is the most important risk factor. Other than that, smoking, stress. If we talk of drugs, then oral contraceptive pills, then various other phototoxic drugs are there that can lead to melasma. So
Okay.
yeah, the most important cause is and the most common is UV exposure, sunlight.
Okay. And doctor, can it be genetic?
Usually, like melasma, if your parents are suffering, then in 1 in 3 cases you can get, but it's not usually genetically transferred.
Okay,
So
okay.
yeah, it's not genetic.
All
Right.
right. And we often say that prevention is always better than cure. So is there anything that we can do to prevent melasma? Because you said the foremost cause is UV exposure.
Yeah, right.
So can we prevent our skin from those exposure or the other causes to prevent melasma?
Yeah, obviously, like for the prevention, the most important thing that you have today is sunscreens. So there are various types of sunscreens. So sunscreens, I mean the volume, the amount, the duration, this is very important. I think sunscreen shouldn't be considered as a type of medicine, which should be in our daily routine. Like you brush, you should use your sunscreen, right? Like some people say, like if they do not, I mean, they do not go outside much, they mostly travel by car and all that, so they do not need a sunscreen. It's a myth. Whether you stay indoors, outdoors, even the CFLs and the LEDs that we use today, they emit UVA and UVB. So it's the same as whether you go out or not. So wearing sunscreen is very important. And the type of sunscreen depends upon the type of the skin, type of the nature of work you have, right? So the sunscreen is the most important preventive thing that we have today. Other than that, you should always use the physical barriers like umbrellas, hat, sunglasses, shades, and all that.
Okay. But sunscreen is the most important thing, and not only to prevent ourselves from melasma, we should have it in our skincare routine,
Right,
and
right.
it will actually, safeguard us from so many things. Doctor, you very interestingly said that it's just not, even if the name suggests sunscreen, it's just not, protecting our skin from the damages that sun or sun rays can cause. It also protects us from all the other form of rays, especially even if we are at home, like I'm working in front of a laptop. We often
Right.
spend our time in front of maybe mobile
Mobile
or other
phones, yeah,
devices,
right.
and they also emit lights,
Yeah,
and
yeah.
those
Blue
lights
light,
can be
blue light.
dangerous for our
Right,
skin. Now, the thing is that in India, despite the fact that we have, we live in a very tropical condition, it's very hot, sun is there, of course, the other devices, etc., is there to damage our skin, but still 67% of people are not using sunscreen, which is really a matter of concern.
right.
How would you like to address to those 65% who are yet not, using sunscreen as a daily skincare?
Right, very, very important thing. So I just now, like I said, sunscreen shouldn't be considered as a type of medicine. It should be in your daily skin routine. So, right, once you take something as a medicine, you start to hesitate from that. So it shouldn't be considered as a medicine, right? And sunscreens, for all those people who are not using it, my suggestion to them is like they should use it as on daily basis, and also the amount of sunscreen that we should use, it should be like almost a finger length if we are using just the face, or a 1.5 finger length for the face and the neck, or you can go by teaspoon, like even 1 teaspoonful. Like somebody uses a pinch of sunscreen and they think they are getting protected. That's a false sense of protection. You're not getting protected. And every 3 hours, by books, every 3 hours, you should try to wipe your face, wipe off all the dust and the different pollution, and then reapply your sunscreen. So, right,
So a sunscreen daily, regularly, at least in every 3 hours during the day. And the amount is also important. Can you shed some more light on it, on the usage of sunscreen? I mean, okay, you have told us what should be the amount, and
right,
how often we need to use the sunscreen. Also, you said that it depends on your skin type, what kind of or what formulation of sunscreen will suit us. But
right,
people are so confused because, again, there is a term called SPF, and it displays a lot of number from 15 to 20 to 30 to 40 to 50, and people are confused which SPF will go, with their work culture or their skin type, etc. So please shed some more light on
right.
SPF and which
Yes.
sunscreen to buy.
See, SPF is the sun protection factor. It shows the level of protection against the UVB light. Apart from that, there are other factors also like PA plus plus, PA triple plus. So
Right.
yeah, and PA factor is for protection against the UVA. So we are surrounded by different types of the wavelengths that can affect our skin, like UVA, UVB, IR, infrared, blue light. So nowadays we have different customized type of sunscreens that can be used according to your profession. If you're like you are in a corporate field, you will be mostly in front of a laptop or a screen. So a blue light sunscreen are also there for the professionals who are working most of the time the front of laptop. Like other than that, we have the broad spectrum sunscreens that contains UVA, UVB as well as infrared protection. Apart from that, basically chemical and the physical sunscreens are there. The basic division is chemical and the physical. The chemical sunscreen are the ones which get easily absorbed in your skin. The physical ones are applied over you. It gives a protection on the top of your skin. So the physical sunscreens are not actually absorbed. So in case of teenagers and I mean the pediatric patients, so physical sunscreens are preferred. So because it's not absorbed, right? So these are the types of sunscreen we usually have around us, and depending upon the type of your skin also, Like if you have a oily skin, go for a gel-based sunscreen, or we have a matte finish sunscreen also, which blends beautifully according to your skin type. Uh, we have lotion-based sunscreens also for the dry skin people. They can go for the lotion-based sunscreens. So these are the different types of the sunscreen that we have around us, which we can use according to our skin types, according to our profession.
Okay, you have very well explained, what all formulations are there and what is SPF and the significance of SPF and other things that are stated on the box of the sunscreen, but we as laymen don't understand them. So thank you so very much for that. But then again, there are so many things about sunscreen. People often say that when they use sunscreen, they feel very oily or they sweat, it makes them sweat a lot, they feel patchy, etc. And that's one of the excuses they use of not using sunscreen on a regular basis. So
Right.
how would you like to address that?
Right. So it's a very, very common complaint for the people who have, who are not used to use sunscreen. So once they start using, they usually complain of a lot of sweating over certain areas, or especially over the T-zone of the face.
Right.
And they complain of excessive sweating. So, you know what, like in order to make your sunscreen in your daily routine, in order to let your skin accept those sunscreen, there are a few modifications that you can follow so that you can easily apply them. Like if you have a sweating, like it usually sometimes, even I agree that even sometimes, even if I apply sunscreen, it sweats, it's natural.
Right.
So you should either have a tissue or a wipe or some hanky only, just dab over the sweaty areas, let the rest of the part get absorbed and work in its way, right? Then
Right.
again, after 3 hours, if you have water, it's better to wash and reapply. If you don't have water, if you're not near any water source, then just wipe it, just dab it properly, no, over your sweaty areas, then you can reapply. So sweating will occur. Sweating will occur. Sometimes even after the this lotion in humid conditions like we have today. So sweating is natural. So you just need to wipe and reapply. Do not wipe. Just just dab and reapply.
Reapply.
Yes.
Okay, so application on a regular basis, reapplication and the right quantity of sunscreen, it all matters. So please follow them strictly, religiously, and have a great, glowing, good quality of skin. Now, again, as you also mentioned, that there are people who work on fields or like farmers, they work on fields, or there are marketing, etc. people whose, working condition is such that their exposure under the sun is more. Then there are people who work from home. Then there are housewives who doesn't use a lot of gadgets as such, but again, they are in the kitchen, working in front of the gas, etc. इन सबके कंडीशंस अलग अलग हैं, लेकिन फिर भी अगर हम इन्हें ब्रॉडली 3 कैटेगरीज में बांटे, एक जो फील्ड में है, जो कांस्टेंट सन एक्सपोजर झेल रहे हैं, एक जो थोड़े बेटर वे में है, या तो एसी वाले ऑफिस में है, एसी के कार से जा रहे हैं, थोड़ा एक्सपोजर हम कह सकते हैं उनका शायद कम है, एक वो जो घर पे है या किचन के सामने जिनका बहुत सारा काम है, लेकिन उन्हें लगता है कि नहीं, हम बाहर नहीं जा रहे, हमारा कोई सन एक्सपोजर नहीं है. नाउ द थिंग इज दैट अगर उनको हमें बहुत जनरल उसमें बताना है कि आपको सनस्क्रीन यूज करना है, एक ये एसपीएफ आप ले लो, और अगर आपकी स्किन डल है या ड्राई है या ऑयली है, इसके हिसाब से ये सनस्क्रीन आप ले लो, इट विल एक्चुअली वर्क फॉर यू. तो बहुत बेसिक चीजें आप क्या कहना चाहेंगे डॉक्टर?
See, as you rightly said, like different professions में जब लोग होते हैं, जो मार्केटिंग में हुए, जो होम मेकर है, और तो थोड़ा सा डिफरेंस हो जाता है दोनों के लेवल ऑफ एक्सपोजर में. I'm not, but having said that, I'm not denying that they shouldn't use the sunscreen, the ones who are working at home. मेरा मतलब ये नहीं है, लेवल ऑफ एक्सपोजर में थोड़ा सा डिफरेंस है, राइट? बट तो जो हेवली कॉन्स्टेंटली एक्सपोज्ड है, उनके लिए एवरी 3 आवर्स लगाना थोड़ा सा जरूरी हो जाता है इन कंपैरिजन टू द वंस हु आर नॉट constantly exposed, right? Because we have to deal with the compliance issue also, because reapplying, carrying a sunscreen in your pocket, keep on applying it every 3 hours. ये बोलने में तो it's okay. We have to prescribe it. But when it comes to the ground in practicality, sometimes it becomes very difficult for anyone, for you, for me, for anyone. But uh, it is also imperative to, if you cannot follow the 100% thing, at least try to follow 50 to 60% of the thing, so that actually you can some benefit you can get from using the product. So जो अगर kitchen में, even kitchen में भी you get to get exposure of infrared and all that from kitchen में तो रहता ही है. So before going to the kitchen, you should at least apply a matte finish wala sunscreen, so that वो ज़्यादा sweat नहीं करे, gets easily blends with your skin type. दूसरी चीज है, जो मार्केटिंग में रहते हैं उनको थोड़ा मतलब SPF 30 is good. SPF 30 is good for the Indian skin types. Other than if you have certain skin problem, like skin problem related to the sunlight or polymorphous light eruptions, then you can go for the higher SPFs. Other than that, for the daily routine, SPF 30 is good because it's easy to apply and easy to remove.
Okay.
Once you keep on increasing the SPF, the greasiness, the viscosity of the product increases, and it becomes difficult to apply and difficult to remove. So that thing is, the higher SPFs are prescribed only in certain conditions, or if the person is going for any procedures like the lasers, the chemical peels, then we go for the higher SPFs, just to give them some extra protection for a few days. Other than that, for daily use, SPF 30 is good too for any skin type for Indian people.
So the bottom line is that sunscreen is very, very, very important. There's no way out. Use sunscreen, use it in the adequate amount, and reapplication of sunscreen in the right way is again very important. So buy a sunscreen as per your skin type, as per your working conditions. And if you have any doubt, we'll always advise you to go and consult a dermatologist before buying your sunscreen, because again, due to market gimmick, there's so many, products, medicated products are there, but people are not very much aware of it. And cosmetic products are so many in numbers that people get confused. So please go consult a dermatologist, buy a good sunscreen, keep applying it every 3 hours regularly without fail. That's really important. And now coming back to our main topic, melasma, we have discuss so much about melasma, but we would also like to understand what are the treatment options available. How do you treat melasma, doctor?
See, what I tell you, melasma, I think in few years, people have started recognizing all those. They have become more and more aware of the skin problems. Right. So melasma, as I see today, some of my patients, they become so much stressed because of this condition, because having a patch, because you're not born with it, right? You get it after some time, and it's very hard to accept a patch on your face. So people get so much of stress. They sometimes they land into depression and all that, and they have some kind of body dysmorphic disorder, like I have this thing. They are having low self-esteem, low confidence, all because of this patch. So melasma is not just a skin problem. It has different, it has landed up into psychiatric issue in other different aspect. So thing is that can you repeat your question?
Yes, how to treat melasma? How do you treat melasma as a doctor?
Right. So basics. First is the use of sunscreen. In the morning, you should always wear a sunscreen as advised by your dermatologist every 3 hours. Use a good face wash according to your skin types. If you have too oily skin, you go for a salicylic face wash. Or if you have a, dry skin, then do not go for a foaming face wash. Go for a gentle cleanser, like containing cetyl alcohol and all that, and sterile alcohol. And if you have a combination skin types, then you can use other face wash also, like glycolic acid face wash, glutathione face wash. Other than that, we have various depigmenting agents. There are n number of depigmenting agents, starting from tranexamic acid, glycolic extract, kojic acid, glycolic acid. So it all depends upon the stage you present to your doctor, at which stage you are presenting. So in India, the most common type is the mixed melasma. We I forgot to mention the types of melasma. It's usually the epidermal, dermal, and the mixed. So in India, the most common type is mixed. So depending upon that, we have to choose the right kind of depigmenting agent to start with. There are also various combinations which are not preferable for everyone. So do not just go for the over the counter drugs, because I've seen most of the people buying over the counter steroids. They keep on applying and applying. Usually it responds very fast for first few days. Once you stop the steroids, it comes with a rebound phenomena. So the most important thing is that do not go for the over the counter prescription drugs. I mean the OTC drugs like the steroids and all that. So other than that, we have other modes of treatment like chemical peeling, lasers. Then we have different types of medifacials also that can help to cope with melasma. See, melasma is a controllable disease. I mean, condition. It's not a disease. I will call it a condition. So it's a controllable condition. It's not a curable thing. So you'll have to learn to live with it for longer periods of time, right? So having said that, I do not mean to discourage any of the patients to go to a doctor कि अब तो ये ठीक नहीं होगा, हम जाके क्या करें, इसका एक उल्टा इफेक्ट ना चला जाए. But it will come and go. There are periods of remissions and exacerbations that you will have to understand and cope with. So उसमें अलग अलग बहुत सारे drugs हैं जो कि हम लोग use कर सकते हैं. Even oral drugs are also there. So that shouldn't be taken on your own. Only if you consult a dermatologist, then you should take those drugs.
Right. आपने जो बताया डॉक्टर से मैं ये समझ पा रही हूँ कि जितनी जल्दी हम डॉक्टर को दिखाएंगे, मान लीजिए मुझे आज से ही कुछ स्पॉट्स नजर आ रहे हैं और मैं एक डर्मेटोलॉजिस्ट को जाके कंसल्ट करूं, तो हो सकता है मेरा ट्रीटमेंट बहुत जल्दी बहुत आसानी से हो सके या उसी पे हम उसको रिस्ट्रिक्ट कर सके. लेकिन होता ये है खासकर स्किन कंडीशंस के साथ, हमारे साथ ये होता है कि हम सबसे पहले कुछ भी होता है हम किचन में भागते हैं होम रेमेडी के लिए, हम अपने किचन गार्डन में भागते हैं होम रेमेडी के लिए, उसके बाद हम गूगल करते हैं, थोड़ा वो प्रॉब्लम बढ़ता है तो फिर हम अपने केमिस्ट के पास जाते हैं, जो भी जैसा आपने बताया ओवर द काउंटर मेडिकेशन के लिए केमिस्ट वाले भैया कुछ बता दीजिए हमें डार्क स्पॉट्स हो रहे हैं, और हमें पता ही नहीं होता हम अपने स्किन पर क्या अप्लाई करते हैं. वी कीप ऑन अप्लाइंग इट एंड वी कीप ऑन मेकिंग आवर कंडीशन वर्स. और जब कुछ नहीं होता, बहुत ज्यादा चीज वर्स हो जाती है, तब हमें लगता है कि अब हमें डर्मेटोलॉजिस्ट के पास जाना चाहिए. लेकिन होना इसका बिल्कुल उल्टा चाहिए. अगर कुछ प्रॉब्लम है स्किन में, प्लीज गो एंड कंसल्ट योर डर्मेटोलॉजिस्ट ताकि वो जल्दी आपका ट्रीटमेंट कर सके, आपको भी ज्यादा दिक्कत ना हो और एटलीस्ट उस पर रिस्ट्रिक्ट हो सके फैलने की बजाय. बिकॉज वी हैव सीन इन इंडिया स्पेशली इन वुमेन, मेलास्मा बहुत जल्दी फैलता है, कई बार पूरे चेहरे पे और बहुत ज्यादा डार्क हो जाता है. एंड so please avoid self-medication or over-the-counter medication and go and consult a good dermatologist. जितना time and money and energy आप केमिस्ट के पास से कुछ लाके लगाने में, 2 महीना कुछ लगाया वर्क नहीं किया, फिर आपने 2 महीना कुछ लगाया, होम रेमेडीज में जितना टाइम आप स्पेंड कर रहे हैं, गूगल पर जितना आप ये सब ढूंढने में या इन्फ्लुएंसर्स को फॉलो करने में वेस्ट कर रहे हैं अपना टाइम एंड एनर्जी, उतनी एनर्जी अगर आप सिर्फ ये सर्व करने में लगा दें कि आपके आसपास कौन एक अच्छे डर्मेटोलॉजिस्ट है, उनके पास जाए, आपका पैसा भी बचेगा, आपका ट्रीटमेंट जल्दी होगा, आपकी स्किन बेटर होगी. Please go and consult your dermatologist. That's really important. I'll also take some of our viewers' questions, Doctor.
Yeah, sure.
Sharma पूछ रहे हैं, what products should everyone have in their skin care routine? I think बहुत अच्छा question है. एक simple daily skin care routine क्या होना चाहिए, Doctor?
Question बहुत simple है और इस actually ये आज इतना complicate हो गया है ना कि we have like all those serums, products and all liposomal and all that without there in the market. People get so confused कि I mean like मैं vitamin C भी use करती हूँ, retinol भी use करती हूँ, मैं Azelac भी use करती हूँ. What should I go for? So it's like I mean, you should understand your skin. I mean, you should understand like आपको क्या चाहिए. जरूरी नहीं है कि every product is meant for you, right? So basic is a moisturizer and other. एक चीज मैं आपको बोलना चाहता हूँ. There are two things that you cannot replace with any drug, any cream, any of the things. Today, tomorrow, anytime. That is exercise and diet. You cannot replace these two things with any of the products, any of the lasers, any of the things out there in the market, right? So, I mean, exercise and diet is very important. Other than that, for the normal skin routine, a good moisturizer, which is according to a skin types, which gives you a good hydration and not a oily face, but a good hydration from inside. A sunscreen. Then a night serum. That depends. If you want to go for a brightening and all that, if you have a dull face, go for a azelaic serum. If you travel too much, if you're exposed to a lot of pollutants and dust and all that, go for an antioxidant like vitamin C, right? And if you are above 25, then go for and if there are signs of aging showing early, go for a retinol.
Okay.
So everything, it's not like you should use all the things. You should know what I mean, for that, you should visit a dermatologist.
Exactly.
Other than that, moisturizer and sunscreens are basic that you should use.
And that's very simple what you said. Just you need to clean your face, apply moisturizer, sunscreen, and a serum during the evening or night. That sounds very simple, very affordable. We can do that. And in case of doubt, in case of any problem, please go and consult your dermatologist.
Yeah,
a very simple question.
Right.
Yes. Yes. Shruti Nigam is asking, do you really need to wash your face in the morning? And with that, I would like to add, doctor, many times people, especially with oily skin, they'll keep on washing their face as often as possible in every 2 or 3 hours. What is the right way? How many times we need to wash our face? And do we need to wash our face in morning every day?
See, washing face in morning, it's a routine. Yeah, you should wash it. So once you get out of your bed, you should wash your face. That's all. I'm not saying you should wash with a face wash. You can wash with normal water also.
Okay.
Face wash will usually recommend twice a day. Okay. Right? Twice a day you can use with wash your face with face wash. Other than that, normal plain water is enough to clean your face. If you're not around, like if you're somewhere outside and you need to clean your face, you can simply use a tissue, soft tissue, or a handkerchief, hanky, just to dab your face and clean it. Do not rub it, because if there are small bumps, inflammatory acne, unknowingly you're gonna burst it, and then again it will turn into post-inflammatory hyperpigmentation. So yeah. So.
And Sri Sharma is asking, what are the side effects of treatment for melasma? Any side effects?
Yeah, no, actually, it depends. If you go for the over-the-counter of drugs, you can land in very serious side effects. Yes, thing is that whatever the depigmenting agents we use or prescribe, it ultimately clears your upper layer of the skin. So long-term use of depigmenting agent should be strict under a dermatologist guidance. So you once, like if you are prescribed for a certain cream for a certain period of time, stop using after that and revisit your dermatologist so that he can adjust the strength, and you do not keep on applying the old cream only, the higher strength cream only. So other than that, there are no side effects, I mean, something to worry about, no major side effects to worry about.
Okay. Ahana Roy is asking, doctor, can melasma turn into cancer?
Oh, no. One word answer, no.
Okay, fair enough. And okay, Shivam Singh is asking, how do I avoid a white cast with sunscreen?
See, that's the thing. I think Shivam will be using some physical sunscreen, which contains zinc oxide and titanium dioxide, that usually leaves a white cast. So, yeah, I think he should replace his sunscreen with a chemical sunscreen that absorbs well with the skin, and it won't leave a white cast. So probably, I'm not sure, probably he is using a physical sunscreen that leaves a white cast, because it gives you, it doesn't get absorbed, right?
Okay.
But
So
that's
Shivam, you need
also a
to,
kind of
yeah.
sunscreen some people need. Usually, you must have seen cricketers using all those white things.
Yes,
That's a
yes.
physical
Alan
sunscreen.
Donald and Andrew
Everyone,
Simons,
right,
they have
right,
those
right.
white
That's a
things.
physical kind of sunscreen they use.
Okay, so Shivam, in case of doubt, please go and consult your dermatologist. They'll guide you. Um, okay, we have Ankit Solanki asking, what are the challenges of treating melasma? So I think, are they the same that you just explained?
Yeah, I mean,
Okay.
it's a very frustrating condition both for the doctors as well as the patient.
Mhm.
I mean, it's a controllable condition. It cannot be cured so easily. So long-term compliance, patience, that's the main. I mean, you have to keep on counseling the patient every time. And so,
Right, we can understand that. Ganga is asking, I'm having jawline melasma since 20 years. And please help me to get rid of them. Any easy or beneficial remedy or affordable treatment?
see, if you're having a melasma for 20 years, like, thing is that the treatment, I mean, obviously the treatments are this almost, I think, has she gone for any lasers or chemical peeling? If not, then she should go for some higher level of treatment like chemical peels, lasers. Apart, and along with that, she can keep using all those sunscreen and the depigmenting agent in consultation with a dermatologist. So she should go for a next level of treatment like chemical peeling, I mean, the lasers and all that. She might get benefited from.
And another very common question that people often ask, doctor, can melasma be permanently cured?
See, melasma is just not a pigmentary disorder. It has lots of components like the vascular component and other things are also there. So, as I said, like it's a controllable disease. It cannot be cured so easily, so fast. So it takes a long time. At least at least if the patches fade away, uh, like more than 40-50%, it's, I think, you should consider it cured, because it's a very resistant condition. So that doesn't mean that you shouldn't start treatment.
Right.
At least you can prevent it from spreading to the all over the face or getting it more dark. At least you can prevent those things, right?
Right. So please start early and do all that you can do to prevent it. Start using sunscreen if you are not yet using one. Please start using sunscreen at the earliest. And in case you see any spots, freckles, anything, please go and consult your dermatologist. And doctor, before we sum up the whole session, any takeaway message for our viewers?
See, again, my takeaway message will be very simple. Sunscreen, very important. Exercise and diet you cannot replace with anything. Other than that, for any depigmenting and melasma or any hyperpigmentary disorder, do not apply steroids. Never apply steroids. Always consult a dermatologist so that you do not damage your face yourself, right?
Right.
So diet, exercise, sunscreen, and dermatological consultation to treat your melasma or any hyperpigmentary or any skin condition. This is my take home message.
That was very simple, straight, short, and sweet. And I'm sure the viewers are going to benefit a lot from this session. Thank you so very much, Dr. Kunal
Thank you.
Sinha. It was wonderful talking to you. Thank you for your valuable time, sir.
Thank you.
It was great to hear you, and we really look forward for many more such sessions in the coming times for our viewers. Thank you once again. And thank you, viewers, for your active participation in today's session. And stay connected to our beautiful Spotless Skin page. Thank you. Goodbye. Good day.
Thank you. Thank you.